Thank you. The documents are just
Good afternoon online. This is Megan. Can you guys hear me?
Yeah, and I'll announce.
Yes.
All right, I apologize to anyone online for the delay, having technical problems, but I am now calling the meeting to order. Roll call. Susan Bartley. Charles Cavell. Here. LaRon Coleman. Colleen Crossy. Benjamin Greenwald. Sarah May. Here. Tanisha Moore. Michael Spitz. Here. Shelley Powell. Pamela Turan. Dennis Yeager. All right, so I have here a motion to approve the agenda. However, we want to amend it because we're right at quorum and someone has to leave early. And in the new business, there are 3 votes. So we want to move up new business to number 8 between updates for committee of the whole and the quarterly financial update. Second? Second. All those in favor? Motion passes. All right, do we have any comments from the public? All right, we will move to the next item, which is OCHN leadership changes. Christine.
Good afternoon, everyone. I did want to bring to your attention, we have some leadership changes at the executive level. We are currently seeking for permanent position our chief operating officer and our chief financial officer roles. Those have been posted, but in the interim, they are static because Tracy's level is serving as an interim COO. Why it's relevant to this board specifically is SUD sits under her purview. And so those of you who know Trish know that she comes background is extensive in health and especially in substance use disorders with the opioid task force early in 15 to 16, all around that. So I wanted to make sure this board was aware of some of those changes. And say something, Trish.
I'll just bring it to us.
You told me I had a 20-minute speech. I keep my shit. No, I just wanted to again introduce myself. I look forward to getting to meet all of you who I don't already know or haven't known in my previous county life. And I'm excited to join the SUD team, I guess.
Do you have any applicants for the other open positions?
I would have to check with HR. I know they were actually I do know that because we have scheduling interviews already.
Perfect. Now we have a provider presentation from Catholic Charities La Casa Amiga, excuse me, from Jasmine Beltran.
Good afternoon. My name is Jasmine Beltran. I work for Catholic Charities. We provide services in 6 different counties. We have 15 different offices, and La Casa Amiga is one of them. We serve the Hispanic population. We've been in the Oakland County for the last 30 years. So we serve mainly immigrants that speak Spanish and most of them doesn't are proficient in English. So our services, we provide them in Spanish mostly. Our staff is bilingual and bicultural. We have partnered with OCHN for more than 12 years. Annually, we serve around 500 people and more than 1,600 direct contact hours from our services. So what we try is to increase protective or strengthen protective factors and work with the risk factors that the community is presenting. So we have 7 different programs: mentoring, tutoring, summer camp, DUI prevention, parent school liaison, parenting classes, and volunteer training. And I'm going to explain a little bit about each of them. So next slide, please. So our mentoring program works with high-risk students, 8 to 16 years old. We try to build a relationship one-to-one between one adult and from the community that wants to volunteer and one mentee. We try to increase or strengthen interpersonal and intrapersonal skills with the students. They meet once a month all together, the full group, and the volunteers work with the mentees once a week, at least for 30 minutes. So they try to build a relationship with them. They try to be role models. They try to be with them and let them know that there is someone at least caring for them. The students that are in our programs present a lot of risk factors like the family dynamic at home is not the healthiest. So they have other behavioral situation changes. They are immigrants. They are coming from low income households, between other things. Then we have our tutoring program. So we work with right now 5 different schools in the Pontiac area. We offer in-person sessions in the schools after the kids are out of classes. And we also offer a virtual option for students that have trouble with transportation. And so they can still be supported while they are at home. These students are behind at the school because of the language barrier. So they don't get enough support at home because the parents don't speak English. So they are getting behind in comparison with their peers at school. So what we try to do is lower the rates of drop out, from the school, and we try to help them with homework and other school assignments, and we practice with them reading and writing as well, and some math. Those are the areas that are behind. Then we have our summer camp, and we run this program for 6 weeks, starting on June, finishing on July, for students 8 to 12 years old. We provide life skills trainings among other programs, music, sports, art, things like that, but also we have a partnership with other agencies that provide life skills and refusal skills for substance abuse. We have diverse curriculum. Those services are for free. Then we have a class that is called DUI prevention. Among the Hispanic population, the consumption of alcohol is high, and usually they don't see a risk on that while driving. So we provide these classes in Spanish. So we provide these classes for infractors, and the codes refer them to us. And also we have adapted the curriculum to provide it for the general population. And for them, it's surprising when they attend to these classes, surprising how many drinks are going to affect their brain and how they are going to perform differently while driving. So it's been a very successful class among the general population. Then we have parenting classes. We offer 5 different curriculums in Spanish as well. Those are evidence-based. The curriculums are already in Spanish by the creators of the program. We don't translate them, so those are already like that. And we try to strengthen parenting skills. So they are, the parents are very happy to attend those classes because they know different things to work with the kids and increase communication and bonding. Then we have another program that is called Parent School Liaison, and we offer interpretation services. So as I say, the Hispanic population in the Pontiac area especially is not fluent in Spanish. So when they try to involve in the academic success of their students, they don't understand what is going on. So we go with them we also do coaching in the system because they are coming from different countries and they don't understand how the school system works here. They don't know sometimes that they need to enroll the kids in the school. So we have found families that the kids are being stay at home for 3 months once that they arrive because they don't know how to go to the school, ask questions, or register them. So we help with that, and we interpret it for them in parents to parent-teacher conferences and other meetings with the teachers or the school staff. And finally, we have volunteer training. So most of our programs, tutoring, mentoring, summer camp, rely on the support that volunteers provide to us. And what we try with them is also train them in substance abuse, protective and risk factors, and other topics that are important for them, important for us as well. So we try to create prevention capacity, increase our capacity, but also create this knowledge in the community so they become agents of change. So once that they are in our organization, serve the population and are trained by us, they now have this information to share with other people, even if they don't continue working or serving in our organization. And is there any question?
Wonderful, thank you. Are there any questions from the board? Colleen?
Not a question, but I do like to hear that you've got like a painting thing, because some people learn tactile, some people learn visually. I just think something.
Yeah, so we, in our summer camp, we offer different experiences and we try to do it hands-on. And with the tutoring program also, we try to offer different materials, so we target the different style of learning of the students that we are enrolled with us. So we have printed materials, but also things that they can touch, board games. And now that the schools are with tablets and Chromebooks, we use that as well. So we try to use different materials to target that. Thank you.
Charles?
Hey, I'm new, so I don't know if this is applicable. Can you explain more how, 2 questions, how you do 1,600 direct contact hours with around 500 people a year? And then how much do you get for that?
We get around $200,000 per year.
200,000?
Mm-hmm.
And then how do you find these 500 people that, and I read that right? Annually, 500 is 1,600 direct contact.
That's right.
3 hours per person per year.
Yes. So we, for the parenting classes, for example, we have 12 people in our groups, and we offer 8 sessions of 3 hours each. And when the parents have other specific questions like related to the home dynamic, we have a staff working with them based on the curriculums that we offer. In the case of the tutoring programs, we meet twice a week for 3 hours, 1.5 hours to 2 hours every day for the whole school year. Our mentoring program also, so we have meetings, monthly meetings with all together, but also our volunteers are working directly at least half an hour. That is no, usually the time that I spend this whole week, one Saturday for 4 or 5 hours a week with the students, plus the training that we provide. So yeah, usually it's around, that's a good approximation.
So then do you have a higher attrition of people?
We what?
Like a higher attrition rate if a lot of people, because it sounds like this 8-week program you said, but then 3 hours a week, that's 16 hours, or times 24 hours right there.
Yes.
But then, your numbers would be, you would have more direct contact hours with fewer people. So what I'm getting is I'm asking people about 3 hours a year. So then, is there like 50 people that you just meet like 30 hours? Or there's 50 people that you meet like 6? Because that's what I'm trying to.
Oh, yes, I got it. No, so each program has different amount of time that we meet with each other. So when we have these big meetings with the whole mentoring program, for example, we have more than one staff member with them. So those hours, if there is just one staff member, the hour is going to be 2 hours. But if we have 2 or 3 staff members, it's going to be 4 or 6 hours. So it depends also on the number of staff members serving that group that we are meeting.
That sometimes these are, that it might be less than an average 3 hours, but you have sometimes 2 staff. Can I ask the group, how do we?
I was gonna intervene here for a minute.
Yeah,
A lot, somebody else can correct me if I'm wrong. But most of these programs that really pertinent to this group, only 3 years. So I look at this list, although the other ones are important, yes, we don't want to take us is fine. Program, if I'm not mistaken. Is that
No, it
correct?
looks like it's for prevention too, which falls under, because it's for at-risk children who are at risk to, use of. Yes.
That
I
is
agree with
correct.
that, but then that crossroads, parity, parent school liaison.
Yeah,
some
all
of the other
that's-
programs. Us, or am I misreading something? Mentoring, tutoring.
So there's crossover in
There are some.
Yeah, there's some crossover. So you're correct in some of those very specific programs. Right, but in your metrics, you that crossover. Prevention always plays a role. So I think from funding and looking at that, most of our providers, they have a business line specific with us that we fund, but they also have other activities that support a community effort. Is that helpful?
Oh, it's helpful, but I don't know, Charlie, if that helps.
Yeah.
Does that help?
a little bit. So then does that mean the $200,000 that Catholic Charities gets comes from OPB for OPB related things, or they get how much of that? Yeah, how much comes from us?
I don't have the exact contract number in front of us, but I will go on Jesse's 200,000. That accounts for very specific program points. How our prevention contracts are set up is called measurement by objectives. And so what that means is every activity that they do, every contract item that we pay for, like the DUI prevention program, they are able to outline based on previous year's numbers. We expect to be able to reach 100 people for this specific program. And here is our cost for that program based on our staffing, resources needed, any supplies needed, travel, if you're traveling, mileage, and all of that. If you think about from the treatment side of things, we pay for things on fee for service every single time someone receives counseling service. It's a flat fee that gets paid. The measurement by objective under prevention, it's just a very different way in which entities are paid. And then everything is tracked through, I won't say it's, and it's, we call it the NPDS system, and forgive me, which I cannot remember what the acronym stands for, but how everything is measured and followed, then providers go into the system. It's monitored by MDHHS as well. And they go in and they put all of their monthly activities into it. So that way we're able to track and see, are they on point and meeting the objectives and numbers that they set.
Last question. They've been a partner for 12 years, at least at the county, with a 3-year contract with 2 1-year extension options, unless it's some weird, rare thing. Is that ever, what's the policy here for that?
So for our contracts, we just changed them to go out to, I believe, 5 years now. Thank you, ladies. I was gonna say, we were at 3 years. We just literally this year, we went up to 5 years. So when we put out an RFP for our services, that contract that we award to an organization goes for 5 years. And then, plus every year it's evaluated to make sure, is the money there? Is everything we need to continue the services? Are we in a good place to do it? Is the provider providing the services they're supposed to be providing and doing it well? And then we renew that contract.
But to become a contract provider, then we follow that RFP process. If there is a need in the community for something before then, we will release an RFP soon.
Right, Shelley has a question.
I guess you shouldn't have said that. Why would a 5-year contract?
All right.
Because how are you assured that you're going to get funding from the state or federal government for 5 years? They can't make their mind up for 6 months.
And I know that we do face the challenges with the funding of what we're getting for, especially the Black grant funding. We know that funding can shift and change. With our prevention services, the prevention services are a non-Medicaid funded service. So everything is either funded by Black grant or our specialty grants that we receive, the ARPA, the CSUDs, the SOAR. So when we do programs that are under our specialty grants, we know typically that there is an end date. And so when we're doing prevention programming under there, we are either telling our providers, SOAR ends on this date, this will end on this date. Or depending on what it is, or as we go along and see the numbers and data, we might see what the benefit is, and then we consider working it into our budget. In terms of the Black grant funding for funding all of prevention services, this is where that PA2 usage comes into play every year that we ask the board for. Our typical for prevention, and I would have to look back, I don't think I'm mistaken, typically our prevention for the entire network, our budget ranges, it hovers around 2 million. We do a payments of that large part with Black grant dollars, and then the other part is the PA2 dollars that we utilize. So typically, even though we do know with the federal government, even with the state, our funding can change. I'm always planning for that. When we look at programs, my first thought is, what is sustainability? Do we have the ability to do things long-term or not? And if we're not doing them long-term, it's very clear, and the contract will also be very clear with the provider. Although under Black grant, it might be 5 years. This is a specialty project under SOAR. This is a 2-year contract.
Thank you.
All right, any other questions? All right, let's move to updates from committee as a whole by Sarah.
Sorry about that one. So the committee, the whole met in the general board meeting last night. I was actually unable to attend the committee of the whole meeting, but we basically go over the same stuff again in the general meeting. So in the general meeting, we passed a special budget amendment to allow the remaining PA2 funds from the previous year to move into reserves. There was, I believe, 4.3 or 4.2 million left over, and it was moved to reserves for OPP. And that passed. And then we had some legislative updates. Dana will be meeting with Senator Price and State Rep Steckhoff to discuss additional funding in the budget, because the legislature is going over the budget now and hoping to finalize in June. And then also to discuss the issue with Medicaid, the recertifications and the issues that are going on with that. As a personal story, my daughter is severely physically disabled. She's always qualified for Medicaid and straight Medicaid back when that was a thing. And this year when I'm recertified because of the COVID Medicaid ending, they denied her. And I'm still waiting to work it out. We've had to cancel 6 doctor's appointments, and I'm paying for medication out of pocket because the way that the system is and the algorithm they're using is just denying or putting people in buckets, which changes funding for OCHN. So they're going to work on that with her. And that's about all for SUD.
Shelley.
I think you just mentioned two funds were put in from this board, it was given to you, was given to the meeting.
Shelley, it was put in our reserves, OBP's reserve, not the general board's reserve. But we still oversee that also, so we have to approve that.
I understand that. So you didn't, what I'm getting to is, you did not spend all of the PA two funding, is that correct?
I just.
So why are we giving you more than this year? That's my question. Suddenly dawned on me.
No, can I clarify? that?
Yeah. Oh, yes, please.
Okay, sorry.
It was hard to understand when I called, that it's on my way out to work through it.
Okay, yeah, I was like, okay, so to clarify. I'm sorry, Sheila Vera, Strategic Executive Assistant to the CEO and Board of Director Liaison for the OCHN Board. So to clarify, at the Committee of the Whole, the budget amendment that was proposed for approval had the actual amount that was paid this year for 5.6 million. And it zeroed out. But this board on September 28th or 27th, 2023 only approved 4.3 million to be spent in SUD money or PA2 money this year. So what was corrected at the board meeting last night is to reflect this board's decision and only put the 4.3 approved budget amount. So that would be netting a surplus to go into the reserves this year. So it's not going above, and yet we still have another quarter and a half to spend the PA2 money for this year. It was just reflecting this board's approval that was done on September 27th of 2023. So it wasn't going over the amount. So in Patrick's presentation, you're going to see what was actually spent under PA2 does not go over the amount that this board already approved.
I don't, to me, this sounds like, I'm sorry, but if you put money in your bank, in your savings account, that you haven't spent, okay?
But there is spending for PA2 this year.
And why did you put the money in the savings?
There's no, well, right now, the budget projection is we can't spend more than what you approved. So you've only approved 4.3. We actually got local tax money for 5.6. So we can't spend more than what you approved. So the rest has to go in the PA2 reserve.
Why doesn't it come back to us?
It is, it's in your PA2 reserve.
How is this board?
This board's, yes,
This board is the only one allowed to spend PA2.
exactly. This board is the only one that is allowed to approve PA2 expenditures.
I understand.
So Shelley, if this helps at all, historically for PA2, we typically got each year about $4.9 million. We would then come in the summertime and we would present the PA2. This is the budget. This is what we're going to spend it on. The board would approve it. And then that's what the approved amount was for the year. Anything that we did not spend then obviously goes into the PA2 reserves, which is overseen by this board. So with the change, there was a Senate bill in last year that went through, and forgive me because I don't have it all in front of me right now. There was a Senate bill that went through last year that changed the sunset, if you will, of the collecting of the PA2 money. It extended the bonds because in 2039, when the bonds were scheduled to be paid off, there goes all the PA2 money no more. And so the Senate bill allowed for the bonds to extend further, which then changed the percentage that we were going to receive from the county for PA2. So instead of receiving 50%, we now started receiving 40%. However, with the caveat that it could be no less than the 2022 or 2023 amount. So even if 40% was 3 million, but in 2023, we were getting 5 million, we still have to receive the 5 million. Now, with this change that occurred, we have actually seen an increase in our PA2. And forgive me, I don't know the exact number offhand. I believe it's 5.4 or 5.6 million that we're now getting for PA2.
It's 5.6.
5.6. So we're now getting 5.6. So we had been approved to spend the 4.3. And then, of course, anything that we, that's 1.3 million, that's going to go into our reserves for PA2. That is the oversight of the board to spend.
And they can't to spend anything over 4.3 for this fiscal year. We would have to come back to this board's approval because you only approved 4.3.
But in reality, this board is not spending that money. Money's being shifted.
No, the money is being spent for treatment services only for SUD. There would be a notation in OCHN's audit if it was spent on any other thing than
We're not spending.
SUD services.
That was last fiscal year in September 2023 when finance came and presented. They asked for $12 million of PA2, and that was to cover 2023 expenses. So there is for 2024, there has not been an ask for that.
Correct. And to clarify, that 12 million still went to SUD retreatment and treatment services.
And my question is, why did we take care of those?
The services were delivered, so I'm assuming you did.
Why did the people in this building? Frankly, why did the substance use take care of people who have substance use problems as opposed to shipping money to mental health and like that? That's my question.
Maybe the misunderstanding is that I think the money just goes through the main board. Is that right? And they approve.
The PIHP board has to oversee the overall budget of SUD. This board has to approve any use of PA2 funding under that overall budget. So but still, PA2 money can only be used for SUD retreatment and treatment services regardless. It cannot be used in the overall budget of the OCHN board. So it has to be used for those services. So on an average, SUD for retreatment and treatment services spends anywhere from $12 to $15 million. So, and some of that is covered under Medicaid and some of that is covered under Healthy Michigan, but it's still SUD services.
And Shelley, I think what you're saying, we had touched on this a bit last time. I think what Shelley is saying is, and I'll paraphrase the best that I can, you're displeased with how some things have been handled in the past, with PA2 money needing to be utilized to cover Medicaid and HMP SUD services for the Medicaid money to go back.
No, not for this board. I don't care about all the people sitting out there upstairs, all the contractors and stuff, every dollar penny of it, the SUD, any other services. My concern is that we're taking our money and giving it to someone else to provide our services.
No,
It doesn't make any sense.
I understand your concern, but there would be an audit finding in our audit if that was happening. It only can be served under SUD pre-treatment and treatment services.
I understand it. But PA2 dollars, okay. PA2 dollars must be used for substance use. Okay, fine, I get it. But who provides the services is a different story.
Our contracted providers for us.
Maybe if we
The
get like a
contracted mental health, not through this group.
maybe if we get a flow chart next time to show how the money comes in and then how it gets filtered to us, would that help at all?
So SUD is a board that's underneath, like in the flow chart is underneath the OCHN executive board. It, like, we provide, OCHN executive board provides the whole, it's like a part of like a family of boards. So we're all the same PIH, like we're all the same unit. We're not separate like companies or
board.
The PA2 money that is used, it is only approved through this board.
I understand.
Yep.
My question is, who's providing services to mental health patients who need SU, who need substance use services? Are you providing the service or is?
They would fall underneath the mental health system, so like for SUD, so Jasmine came from La Casa Amiga. That is one of our prevention providers under SUD. Our SUD specific budget, PA2 money, if that's what it's being used for, that's how they're getting paid. Christine, I will leave you.
Yes, that's the problem.
Supervisors.
When mental health provides substance use services to a mentally ill person, who provides those services? Which group? Mental health or substance use?
So it can be both, because people have co-occurring. So when you're, and what you're asking about, Shelley, I hear you. So the PHP system, the public mental health system, is responsible when SUD came up. So it's responsible for mental health, substance use disorder, and persons with intellectual developmental disabilities. So the PIHP is that entire umbrella. Within that umbrella, the PIHP is responsible for substance use services as well. But the Oversight Policy Board, and what was very specific about this board, to your question, is the PA2 came into the PIHP system. These boards were set up to ensure that PA2, every PIHP has them. Every Oversight Policy Board actually functions a little differently. In this county, and I know you know that, in this county, this board is responsible to ensure and vote on the fact that PA2 are only spent on substance use prevention and treatment. Individuals can't have a primary diagnosis that may be their substance use disorder, it may be their mental health. We treat everything as co-occurring. And I know you know that, right? Because it's difficult to say that the substance use become before the mental health and the mental health become before the substance use. So from that perspective, we treat the whole person. If it is, they come in through Access, it's diagnosed, and it's looking at right? So Access team, they do their screening, they say this individual has a substance use disorder. Primarily, they're going to connect them to a contracted substance use treatment provider. He or she's mental health services will also be addressed. And those contracts sit within OCHN because we are the PIHP. Where there's the difference in specifics, the funding piece. So the PA2, which is your responsibility, is to ensure if I have this provider, they serve treatment, they're doing this, they are receiving PA2. PA2 would not ever go to a provider who provides intellectual disability services.
Or mental health.
Or
So everything's built under a code, like insurance. So if somebody's receiving substance use
So
insurance.
you're telling me that mental health contracts with substance use providers to provide substance use services to mentally ill people, and what I'm saying is this. Mental health, that's not their bailiwick. Their bailiwick is mental health. The guys, these guys over here, their bailiwick is substance use. Why aren't you working together? No, because you're not letting this group decide where are you going to shift, where are you going to send them, substance use people, what co-occurring problems. I'm only disagreeing on the way the operation of it. I think that all the decisions in substance use should be, substance use or abuse, whatever you want to call it, should be in this substance use organization. Now, listen, I wouldn't go to my father to have my appendix. He's good with his hands. He's really good with his hands. He can fix anything. He can even fix my air conditioning. He can tell me he can fix my roof, but he's not doing my appendix.
So contractually, the PIHP has to provide substance use services. So that is part of our contract with the Michigan Department of Health.
I understand this. I understand that you have. But why aren't you using this group to screen? That's not your baby. Your baby doesn't substance use. It's not a little.
Well, and we do though, that's for everything SUD, whether it's the PA2 or me going over our grants and how we're using the funds and everything that we're doing. Those are things that I bring to the board and then the rest of the team will present on as well, all of the initiatives that we are doing.
I understand what we are doing, means this board, or you are doing. What I don't understand is why mental health is contracting with substance use providers for their clients without having any input from substance use.
So to clarify, we have, the THP board, we have mental health, substance use, and intellectual disabilities that we have to provide services to in Oakland County. So if I walk into the access center in Sheila and I have a substance use issue, they're gonna send me to the contracted provider for substance use. If I'm also diagnosed with things.
Contract is no.
I could be, yes, if I needed services under that, but it depends on but I couldn't. So depending on what different services I would need, yes, your answer is correct. But if I would need substance use services, I would go to that provider, and that's the only thing that could be billed under from that provider.
I was in there for 30 years.
Okay.
You're not, even if you don't want to answer, you're not understanding.
I guess not.
Pardon me?
I guess I'm not understanding.
Okay. So as far as I'm concerned, contracts for mental health services should not be led by that thing. Okay? You should not be looking for contractors for mental health services. That's out of your baby. It's out of your department. It doesn't.
Do you mean me?
Yeah, you. Okay?
We don't contract us, for SUD, we don't
Of course not.
contract.
Of course you don't. So why should mental health contract for
So I think this will be helpful, Shelley. I'll do it the sidebar. We'll get together the contract for the PIP, because I do understand what you're talking about. We'll get together the contract for the PIP system, so you can see how it all entertains within our PIP system. We have separate teams who, that is their area of expertise. To your point, we have a team, a PNT. We have a team that oversees intellectual developmental disabilities. We have our SUD team. But all of the services sit under the PIP in itself and the CMHSP. So what I think I'm hearing will be helpful, and we'll get it to you, is what that access and screening piece looks like. Because we have a team that when somebody comes for help, and the clinical teams in their area of expertise, they do the interview, they do the screening, they determine what does this person need? How do we then connect them to those services, whether it be mental health side, whether it be the substance use, or whether it be intellectual developmental disabilities. That is our requirement as a contract. So I'll give you the contract, but I think more importantly, what I'll get for you is what that diagram looks like on how people, when they come to get help, how are they connected, and then how is that funded? But it all sits under the PIP.
Yeah, I'm gonna ask that we move on. Is that all okay? Okay. Yeah, maybe you can bring some of that to the board, since the whole board has been brought into the conversation. Okay.
Charlie wants to.
It's okay, it's about.
Okay. All right, so
Maybe I have a question. How much do we have in reserve?
It's right.
Finance will, finance will go over that.
No problem.
all right, that all came from updates from the of the whole. So we will now move to the amended agenda of new business. So the first part comes from a follow-up from last meeting, when we discussed member roles, fiduciary obligations, and responsibilities. So oh, sorry. I was just starting at the beginning. All right, I apologize. So new business starts with motion to approve February 2024 meeting minutes. Do I have a motion?
So moved.
Second? You gotta speak into the microphone.
Second.
All right, thank you. All those in favor? Opposed? Motion passes. All right. Number 2 is the PA2 request by Megan Phillips.
Thank you, Kelly. So I wanted to come to this board and ask today, there's 2 asks that I have regarding the use of PA2 funds. I first want to lay the groundwork and say that the budget approved for PA2 this year is $4.3 million. The ask that I have for how to use these funds does not exceed the $4.3 million that was asked for. When in September, when the board approved the $4.3 million, I had also gone over a list of what we utilize the PA2 funds for SUD services. The 2 asks that I have today, they were unknowns at the time, so they were not listed. And so hence I come before the board today to describe these 2 items and ask for the board if they would approve for the use of it within the approved budget already. So the first item is an IRB research project for OPBI. So IRB stands for Institutional Review Board, and essentially an IRB, it's according to the federal regulations for the Department of Health and Human Services and the FDA, any type of study that involves human subjects has to go through an institutional review board. And essentially what we want to be able to do with OPBI, we began using OPBI a couple months ago. We have partnered with the Oakland County Sheriff's Department. We were the first in the nation Sheriff's Department to be utilizing OPBI in the community. What we want to be able to do is collect useful data and make sure, because OPBI is being used on human individuals, we want to have an IRB in place so that way everything is ethical. We are following the standard and guidelines of what we are supposed to do. What we want to be able to do then is be able to assess and look at and compare to Narcan as well. What does it look like? We have some grassroots organizations when it comes to OPBI. They have a lot of concern about how strong it is and the precipitated withdrawals that someone can be put into. Narcan person you can also experience precipitated withdrawal. And so we really just want to do our due diligence to be able to make sure and demonstrate that the use of OPBI, we are not doing harm. We are showing what the positive effects. One of the positive effects we believe with OPBI is it lasts for so much longer in the body than Narcan does. So with Narcan, within an hour and a half to 2 hours, you can slip back into your overdose and ultimately die. With OPBI, it lasts in the body for multiple hours. It typically, according to the studies, it's going to outlast the overdose. So we want to be able to just have a study, worked with Wayne State University, and really be able to collect data that's in an organized fashion and be able to look at everything. The second request that I have is a vehicle for one of our providers. So underneath the state opioid response grant, we have our Save a Life boxes. I love my Save a Life boxes. So we are increasing the Save a Life boxes. We had a ceremony with the Sheriff's Department and the Board of Commissioners, where we had put our 100 boxes on the county campus. We are actually going to increase our Save a Life boxes to a total number of 150. So with having 150 Save a Life boxes in the community, those all require restocking of all the materials that are inside of it. And so from 10/1 until the end of March, we have so far paid in mileage to our provider who is overseeing that initiative for us, $24,000 just in mileage alone for those 6 months. And so really it makes the most sense that we look at obtaining a vehicle for them. I, of course, immediately looked first to all of the grant funding that we received. One of the challenges with that are, it is not, for some of the grants, it is not it wasn't written into the grant for it to be an allowable expense. The second issue is if I did do it under one grant, once that grant ends in 2 years, because it's federal money, SAMHSA can come take a look at the inventory of items and say, oh, they're, like, I think it's anything over $5,000. They will review, they will look at it, and they can choose to take it back. And so even if we did a vehicle underneath the grant, SAMHSA could come in and ultimately take it back. So the dollar amount for the vehicle that we would like to purchase for the Alliance's use would be $38,000, and the IRB research project, that is a 2-year research project. The total for both years is $275,000. And again, all of that falls underneath the current budget.
All right, any questions, comments? Charlie?
So a couple questions. First, the budget that was approved. That's before I should, that was that's $4.3 million. That was for things that were already budgeted. These things were not budgeted. So how do you make that work?
So with the $4.3 million, and I don't want to speak too much to things for finance, we can budget for items that we believe this is what the cost is going to be, and then there's actuals that come in. We are under budget. And so that is how the money is there.
How much under budget are you? Ish.
I would have to defer to finance on that. I didn't know from the last quarterly update. Last quarter, when they presented to you, the actual spent was $941,000
For the year.
for the year. At that was what was projected at that time. That was 3 months ago.
And you, just to make sure you're right. IRB is the money of 275 is going to Wayne State for the state.
We would actually, it would be our provider who would lead it for us, so we would be paying our provider who in turn would contract with Wayne State to lead the IRB study.
Who's the provider?
The Alliance, they're the ones who are overseeing the state line boxes. And then they also have the partnership with the Sheriff's Department with having being on crisis response unit.
And then the last question is, buying a vehicle. That's us purchasing something for a provider, if I hear you right. And then, so we're giving them an asset. They're not paying for it. And then also, are there other things we can do that doesn't sound like penny wise and pound foolish, but like, you know, the county has 500 cars. There's a shit ton of sheriff's cars that just sit in parking lots too. So like, you know, I guess all the time. Is that, I mean, what else was taken into consideration?
What was,
Also,
yes, what was,
different assets.
yes, no, what was taken into consideration with it as well is, it's people's personal vehicles that are being used right now. So with the environment we sit in the workforce, when they're looking to hire people, they're asking people, yes, we're hiring them as a provider and within this industry, you're not getting rich by doing this work. Right, and so that to then say to someone, hey, we also have 150 boxes all around Pirates Fair County, you need to use your own vehicle. We'll pay mileage for it, but you need to also use your own vehicle to go replenish all these boxes weekly. That's a hard ask to ask, somebody who's going to be hired and coming to an organization.
But no, I know that, but
Yeah.
there are not steps in between. You pay your own mileage and we will buy you a car for this.
Oh, what do you mean? I'm sorry.
It's like how the county has facilities and maintenance where the sheriff's office that has hundreds of vehicles or gas that is paid for by the county already is like a sum budgeted cost. Like, were there any other considerations to talk with other people or
Oh,
other
you need to
entities?
talk with other entities.
Providing you-
The Alliance did, they had talked to the health division to see if they could utilize a vehicle, to do the refilling of the boxes whenever they needed. My understanding is that it didn't essentially move forward. And so that's why we were out.
And then why is it us using these funds to buy one for them and not them using their money? or splitting the cost or something?
No, we are asking to buy for them because it's our initiative that we asked for them to take on and oversee. So with them, they're a nonprofit, they're funded 95% by us. So the ask was, is that something that can be assisted with? And it's something that was wanting to continue to see this initiative, Save Life Boxes move forward. I think it's beneficial.
Do we know, or one of the things they would say this, what, like the margin for our partner agencies or whatever they're called, other vendors generally is allowed? If it's something that's like 95% by us, it's basically a subsidiary.
Yes, and I know my finance probably knows that.
Sure.
I
guess then I don't know how to do this one. I would love to see that.
Yeah, that would have to be at the next meeting, if that's an ask. So that,
So, but yes, it is the Alliance who refills the boxes, and that is what we ask for, is the purchase of vehicle for them to be able to do that.
all right, we have questions over here.
You tell Charlie's not on this. But similar questions as Charlie. Just what I'm clear on understanding this. Would we own the vehicle or would it be our asset that we're to use?
Sheila's coming up.
OCHN, so we would not own that vehicle. My assumption would be the Alliance would own the title on that vehicle.
Okay, so from a legality perspective, they'll buy it, they'll charge us. They find it, charge them, they'll pay 95% from them, we'll be paying it. So, going similar path that Charlie's going on, does it make more sense to lease or buy? You mentioned $24,000. I don't know so far. I don't know. 62 cents a mile. How many miles is that? Does it make sense to lease it versus buy it? Because in many cases, buy an asset, especially a car, it depreciates so fast that if you lease it, warranty, you get this, you get that. Another decision on it, buy or lease.
I don't know. This is my first hearing about the vehicle, so I don't know what she said so far.
Maybe it's just the leasing is not fast. You know, cash outlay that they have to give out.
Sure.
X amount of dollars. And the monthly fee we already paid. So you don't have as much cash going on, paying $2 today.
Correct.
That you do go.
Correct. They could submit. I would.
Well, those are just my questions. I'd like to see that information. But is there a timeliness on this? Other than we're paying a mileage?
No, there's not. We can certainly come back at our next meeting in July and provide some more information.
In general, I support the concept, just how we get there. That's what I think I need to see.
We could shoot for the 10-1.
Charlie's probably the same.
New fiscal year, you could shoot for that estimate. So,
Shelley, did you have something?
Well, my friend next meeting, answer all my questions, so thank you.
On the same page. All right, any other questions before we ask for a motion? All right, do I have a motion to approve $275,000 for the IRB project and $38,000 for a vehicle for the Alliance?
Well, did we just want the maybe table the vehicle till October, July?
Did we say that?
This is what we'd like to, so I can make motion to set aside item
Okay.
B. Then I'll make motion to set aside the
Wait, so Shelley had more. Right,
I have a question. Call the roll.
yeah, I was,
That's one.
usually if it's money, I always call.
That's one correct mistake.
Yeah.
Right, right. Okay, so should these be two separate motions then to table?
yeah,
Okay, so could we have a motion first to table vehicle for the Alliance funding?
make a motion to table the vehicle purchase for Alliance. Until next.
All right, so I'll do roll call vote. Charles Cavell,
Yes.
Colleen Crosby, Sarah May,
Yes.
Michael Spitz.
Yes.
Shelley Town,
Yes.
Dennis Yeager.
Yes.
Okay, now for the first request, $275,000 for 2 years for the IRB research project. Do I have a motion?
So,
Second?
I'll support.
All right, roll call vote again. Charles Cavell,
Yes.
Colleen Crosby, Sarah May,
Yes.
Michael Spitz,
Yes.
Shelley Town,
Abstain.
Dennis Yeager. Motion passes. Who voted no? Dennis? Sorry, don't mean to call you out. Okay. All right, so moving on to,
You need to make a vote. 6.5. No, is that just the financial line? We already approved the budget of 4.3, but with 5.4 coming in. Keep that into reserves or no? Is that?
I think the higher board did. Yeah,
That's already been done. You don't need to vote on it here. I see a lot of heads going.
correct. No, I believe we'd be able to tap into it next year when we approve a new budget.
Can you clarify?
My question was, since, you know,
Right.
we had a lot of discussion about it, we approved 4.3 budget wise.
Correct.
We received 5.46. So we're moving 1.165 over to
The VA2 reserve.
reserves. Do we need to approve that to reserves? No.
No, you
Is it
don't.
automatic based on funds?
Yeah, the only thing you need to approve is the expenses of VA2 funding. You don't need to approve money going over to reserve. Correct. You only need to approve any spending on VA2.
All right, so moving on to the third part of new business, we have Megan with a proposal to move the August meeting to July.
Yes, so, our next scheduled meeting would be, I believe, last week of August. And in discussion with executive leadership, what we are asking is the board to consider moving the meeting into July. Kara will be able to provide some dates right now, and the reason and rationale for that is, Finance today, they will present a draft overview for the use of PA2 funds, but I think the intent is in July, they wish to present a more detailed account for PA2 as well as the fiscal year 25 budget. And the board, per the bylaws, the board needs to approve the use of any PA2 funds for fiscal year 25 budget. And then you're also able to review and give feedback regarding the rest of the funds, the dedicated HRP funds that are used. So in terms of them, in terms of finance being able to do their work timely and make sure they get the budget to the OCHN board in September and account for any changes that could need to happen, we're asking if we could move the next OPB meeting to a date in July. And Kara, do you have any dates that you're able to provide options for?
We have, we were trying to keep it on Wednesday, just consistency, Wednesday, July 24th, or Wednesday, July 31st.
Is it already shown?
That might have been the old one before we moved to Oregon, when we were 5. Yes, instead of August. Sounds like I'm hearing. Okay, sounds like I'm hearing. It's good.
Yes, July 24th or July.
Is everyone good with first? Right, can I get a motion to move the August meeting to July 31st? Second? All those in favor? Opposed? Motion passes. All right, back to the agenda. We have the quarterly financial update from Patrick Franklin.
There is presentation include the update. We'll provide a quick update next July meeting on quarterly. And the PA2 balances. Discussion concerning PA2. So yesterday we had an OCHN board and last night and approved the amendment last night to the PA2. Just as a reminder, last year we'll be each year any use of PA2 funding for the next year that can incorporate into the overall OCHN. So that's why we're coming, present this during this meeting. So if you want to go to the PA2 SUD slide. Purposes SUD PA2 funding. Approval of any department of designated mental health is the budget containing local funds for treatment or prevention of substance use disorders. Advice and recommendation regarding department designated mental health budgets for substance use disorder treatment or prevention. On local funding sources. See advice and recommendation regarding contracts for substance use disorder treatment or prevention disorders. Next slide. So as already was discussed, the OPB board approved the use of 4.3 million PA2 funding expenditures for SUD pre-treatment treatment services September 27, 2023 for the FY 2024 budget. PA2 funding received in 2024 was $5,465,856. The approved amount of 4.3 million will be utilized for SUD pre-treatment treatment services as required per contract with HHS. 1,165,856 surplus is added to PA2 fund balance. Current balance for the PA2 balance. Fiscal year balance for FY 23 was $10,625,006. With the surplus from the PA2 funding for this fiscal year, for any balance would be $11,700,000. Next slide talks about request for this FY 25. So based on PA2 funding, the balance was approximately $5.5 million that was received. Funding PA2 funding for FY 25 expenditure requested $4 million. going to be possible surplus or possibly fund balance for fiscal year 25. So that is what the request is week, to allocate those funds. So we're going for budget.
Shelley, or,
I think Charlie had a question.
right, okay.
Now,
Did you, I saw you kind of raise your hand. Did you still have a question?
Yes, so kind of like 2 or 3 things. One, I think Shelley's gonna like this, because looking at, Shelley, were you gonna say something? Okay, so if you go back to the first slide you had here about how these monies can be spent. What, if I understood what Shelley was trying to get to earlier, everybody, and Shelley, tell me if I get this wrong, is that, yes, these are all under OCHN, yes, this all kind of works, but having been in government like us, we kind of know that, you know, these ABC uses for PA2 monies, these can be broadly stated enough where you're not getting an audit finding for misspending money, because you're not intentionally misspending money. But we are, if I get what Shelley's saying, perhaps foregoing our prerogative or letting go of our power as an OPB by then giving $12 million to the board as a whole. Is that kind of what you were getting to, Shelley? That like we could spend, maybe that, we don't have to get into it, but I'm leaving that to say, if I'm understanding what had happened before I showed up, where then can I figure out where that $12 million went, if it's supposed to be in our savings account? Sorry to make you walk so much. But if we're, you know, if you know, $12 million. Us voting in September to give to the OCHN full board to then figure out how to execute.
So to clarify, it was the $12 million to reallocate SUD treatment services from Medicaid and Healthy Michigan to be paid for under PA2 funding.
Okay, got it. So it was a shuffle. Understood.
Yes,
Okay.
but for SUD
Yeah.
services.
No, I get it. It still counts and it's still helping, but
Yes.
there was a budget gap in some other line item that was still with these monies.
Because
Okay.
PA2 is more restricted,
Yep.
right? You only can use it for those services.
Yep.
Where we could free up Medicaid funding for that is less restrictive.
Yep.
Does that, okay.
Yep, I get you. So Shelley, I get you. They were giving you a hard time. I get it. So then, you're cool, you're cool. Hey, you got what you gotta do. Okay, I get it. No, okay. Well, so then that being said, 2 questions. Should we expect another huge hole that then we're going to in September need a kind of like shuffle to then make the dollars work for the rest of those OCHN? Is this something?
No, our budget amendment that was approved last night only reflects the 4.3 million that was already approved by this board. There was no additional ask.
No, but I'm saying in September again, are you guys gonna go crash?
It's not anticipated. The 4 million is only for fiscal year 25.
Okay, so then my last question is, when we have our next meeting in July, we're gonna get another financial update. One, I would love it to be thicker, and more robust, like who are our vendors and how much do we give them, sort of thing.
So, yeah, and as Patrick noted, we just got a budget amendment approved, so he'd be able to give you more of an update in July, over the overall SUD services. So,
Yeah, like just be able to very easily see at a normal level looking budget.
Absolutely understand that.
So that's kind of part one of the second point of my last thing is, question is then, that's the money side, but then the policy side. We have a consistent flow of revenue that we can anticipate. We are not reaching that, like we're not going over the money that's coming in and expenses. And we have this huge balance. I mean, isn't our job to spend a lot of money helping people with substance use disorder? Is there already a policy in place for how to act? I mean, it seems like this is a lot of money. This is over 2 years, well, it's about 2 years of worth of funding we get sitting here, and it used to be twice as high. So what's the plan for this, if there is one, or is that our job?
So it's your job, but if I'm hearing you correctly, you want me to spend more money? I'm just kidding.
That's our point. That's our point. I love taxing.
Yeah. And we want to keep a reserve fund if there is ever an issue with Medicaid, if there's ever an issue with HMP, we have the ability to pay our providers. When there have been issues with the government saying we're going to shut down, we don't have an issue paying our providers if there are issues with the money flow coming from the federal government or the state.
So our providers then, the HMP, whatever providers, are those for, are those people like the Alliance doing direct stuff for us, or are those something else that?
Yes, all of our providers, all of our country providers for SUD, they are the ones directly providing services for treatment, for prevention. I'm trying to think offhand to make sure I'm not missing anything. I don't believe, unless I'm forgetting a tiny small thing, none of our SUD contractors subcontract out any of the services they're doing. They are providing those services directly.
So then is there a fund balance policy for these monies that we've made or anything? Like there's a kind of like a recommending of 25% on layaway just in case the government shuts down or we're in between receivables and payables?
Not specific to SUD, the PIPs do have is we have cap limits on what we can fund reserve. And in the funding piece, maybe that will really be helpful to you, Charlie, even to the board to understand our funding sources from so many different angles.
Yeah.
So Medicaid, we get our last numbers usually in August. One of the reasons that, based on our conversations that we had in fall, is that with PA2, with SUD services, when we're getting ready to build our FY22-25 budget, which we should start doing in May, all teams come in. Everybody looks at it and says, here, this is what we expect. One of the things we wanted to do for transparency and to stay connected with this board was to start here as we build with the process. So this was going to be our foundation as a commitment. We made that commitment to the Oversight Policy Board last year that we would begin those conversations about our FY25 budget. So this is the very first phase of looking at FY25. We usually do not get our rates for the state for Medicaid until August. Sometimes they come in early in July, but most of the time it's August. The way that works and why it's critical is as API, the overall OCHN has to have its budget approved by the board in August or in early September. It has to be written and approved by the board, because if it's not approved by October 1, you can't be a PI2. You're out of contractual. So that's one of the reasons we're starting here, so that in August we go to the overarching board. They will review the budget, they vote for it in September, and then we can stay in compliance with our contract with MGHHS. It's a very fragile system, and it's not typical of your business. Right, I know my profits, we don't know our rates until they come in. So we do a lot of preliminary work in May, June, July. When we get our rates in, our budget finance team digs in, applies the rates, we know the actual numbers. So this was part of to the Oversight Policy Board last year, that we would start with historically, this is what we know PA2 we spent. Let's look at that and we're get kind of an understanding of what we may or may not spend in the upcoming year. Then we'll build our budget on our historical records from last year. When the rates, when we know what grants, all that other information, and all the numbers will be finalized and then move forward. But part of that is you can't be a PIP once your budget's.
Okay. And
you still have more, because I know Shelley's waiting.
So just to round out the point, so thank you for that. I would love to, I mean, at the July meeting, learn how we as a board could be more, try to sound smart, like, let's spend as much money as we can because there's real problems and it's getting worse and it's not getting better. The county is all doing settlement dollars. The county is putting money into a housing trust fund for people with substance use disorder. I mean, this would have been a great bridge dollar amount if that's allowable. Right? There's all sorts of things we can and should be doing. Other than letting this, I mean, right, this probably is gaining interest, right? Like this is not in a CD or something, right? So not allowed. So like this money just sitting here losing value to an extent feels like a disservice to the community. So I'd love to help.
I agree.
Great.
Look, and the board always has the opportunity, are asked to submit items for the agenda for meetings. So when Kara sends out the, notice to say, what do you want put on the agenda? Then you can put it in your own words. Shelley.
Shelley, in answer to your question about why that money's sitting there.
Yeah.
My answer to you is this. We've never had that much money that I would call. But during COVID, gobs and tons and hundreds of people, right? We don't have COVID. And thousands and thousands. Our money is based on the number of people we have on Medicaid. We have, let's just, I'm making that. Let's say we got $1 per person. We don't, but I don't even care. It doesn't matter. Okay. Now they're coming off. This is the first budget I think we've had where they are coming on the state, coming off of Medicaid. We may need every darn dime of this money to continue giving the type of services we want to get. Our numbers have gone down. I don't know if you've noticed in grocery stores, every place else, things are fortunate. So consequently, our pay scale is going to have to rise, things like that. So I'm not looking to spend this money until we get a budget put together and know what we need and how we're going to go forward with this, because I'm very, very concerned about, and we don't have, unlike the Board of Commissioners at the state legislature, where you're sitting your township officials, we can't raise it. We can't raise that in our money. We're stuck with what they give us. And they're hurting in Lansing and they're hurting in they're hurting in every little town and village because they don't have that extra funding coming in. Now, some people were wise. They bought fire trucks, or police trucks, many people spend on godly work and they're going to have to suffer. So that's what I'm saying. Before we start looking at how we're going to spend the 20,000 or whatever it is, we better look at the budget, see how much of that we have to spend here. Then I have another question. This is my question. Under the budget, who is providing substance use services to mental health patients? Who is contracting for? Are we doing the contract for them? Are they using our, or are they going to finding Joe's contract in mental health? That's what I want. Substance use.
No, they are using our contracted providers. It's a matter of a person's choice of which door they go through. And so what I mean by that is somebody with a significant mental health disorder, they may choose to seek out, I call it CMH level of care services, which is our level of care services through our providers. If they feel that's the primary issue to address, they might go through access, they might get a mental health diagnosis and be sent to one of the core providers. At the core provider, that core provider receives funding solely under mental health. They might have co-occurring disorder and receive some SUD services, but it's not funded by SUD. It is funded by mental health. And then no different than on the opposite side, somebody coming through, they might see have SUD services and they might have a mental health disorder, but they say, I want to choose and go the SUD route because our system is based on choice. Once they're at that SUD provider also, they're only getting paid through SUD funds. They will provide the co-occurring services. Does that make sense?
Now I understand.
Got it.
I got it. To me, that's still, that's accurate. To me, it makes sense, make more sense that you screen here all the substance use people and say, you've had problems with Joe and Mary. What suggestion of using, as opposed to they do their own screening, you do your own screening. Who you use some of their mental health providers, mental health co-occurrence.
And we do have that. One of the core providers for mental health is Mr. Seals Moore, and we're also an SUD. So we do have that one that process.
All right, I am,
In Oakland Community Services, but that is, we do it for adults, OS for kids.
all right, I'm not gonna call for a motion to approve funding request because it's not, it wasn't put on the agenda. So it's a little bit of a surprise and wasn't approved on the agenda. So that'll be moved to old business at the next meeting. Pardon?
We're not funding
Yeah, that's why we moved it up. Right, July is okay. Well, it's on, no, there wasn't.
The request, yes, I did. I sent the request to add the PH2 budget to the agenda. I think what Kelly is saying is that regarding, Kelly, please correct me if I'm wrong, regarding voting errors, don't feel you wanted it to read on the agenda that there would be a vote for it, or just the board? We should have voted.
Well, it's not on the agenda.
The
And I
PH2
think there's a lot of discussion on it that,
It's 8B on the agenda.
right, but it just says activity balance update. It doesn't say requesting, PA2 funding dollars. I thought we already approved this, the funding dollars.
Yeah, here's my question, are we speak proactive so that we don't do the last minute budget approvals that we get in September? Is that what we're doing right now?
Yeah.
Is trying to ensure that we get it done so we're not rushing and trying to make sure we have a quorum. I think we said 5 times.
Yeah, we don't have a quorum anymore. It was just pointed out to me. Right.
So some of Charlie's points. Well, yeah, similar points. You're only asking for $4 million. If there's other programs that Charlie has, it is that. We haven't heard of them. So how do we address those? And I know 4,000 is just a piece of the pie. There's a couple of the programs they want to consider. Do we bump that up? We just say, okay, let's do like 4.8.
But it's a reserve, we can ask to use it at a time, it's an hour reserve, we can ask to use that, but it's just.
So then why, if I do that, why wouldn't I just let?
Good.
Oh, I know, but now we know.
It's for next year, right? So,
This is for this year's on this.
No, this is for fiscal year 25.
Yeah, so I know we don't know exactly.
yeah, I didn't get that either.
Right, but what you could do, Commissioner Spies, for your recommendation, is you could say, we approve $4 million and we want these serviced under it. We want these items to be allocated under that $4 million to specifically meet the request of what this board wants to see with it.
Okay, I can read that, but I'm staying.
That was not my point. And then our quorum left. Because that was what I said, and so he asked permission to leave.
And if I make it.
Yeah, for an approval for the July. Okay.
Sorry.
So would this board be okay with, because we're doing a budget build out, so would this board be okay with an anticipated approval for just to start building out the budget but not putting in that to the final request of the overall board until you actually approve it.
Honestly,
Okay,
my ask was like additional.
okay,
Get a 10-year rolling, receive DH, but
yeah,
the last 10 years. So when we get some type of history, we see some type of trend, and it'll give us a better idea what we can.
okay, we can certainly give that of the money received throughout the years, yes. And then that will come with kind of the ask, but we'll anticipate a $4 million to include it, so we can start our budgeting process for the overall OCHN board to include that under your guys' approval. And then, but we won't put it in the final until you guys actually approve it July. And Ms. May, you were correct, because we were trying to prevent, so typically we would like to ask this to be a standing item in May. As an approval request, so we can start the budgeting process of any PA2 for the following year.
Okay, yeah, I guess if we were more prepared
Yeah, so,
with information and.
yeah, so we could, if going forward, if we could typically probably put this on the agenda in May.
Right.
So, okay, thank you.
And then if, what Michael's requesting, if that could be included with. it.
Absolutely. Yeah,
Okay.
yeah.
All right, was there, oh no, you guys still have more, was there more discussion on that point? Okay, so it looks like you guys have one more point.
I just have 2 points, this is real simple, quick, with open items from previous. So, one of the acts was what was the spend for the underserved individuals, that number is, 90,700. Back to that, close to that. And then, the second one was information on competition. So, there's been a link to the handbook provided for everybody to have looked at this observe, ask questions, or what have you. However, just a few points. The care coverage is for ages 19 to 63 years. They have income at 133% of the under adjusted income methodology. Do not qualify for or are not enrolled in Medicare. Do not qualify for or are not enrolled in other Medicaid programs. Are not pregnant at the time of application and are not residents of, and are residents of the state of Michigan.
They aren't the residents of Oakland County.
Well, that's just Healthy Michigan, so that it would, kind of go on a base by base, but I believe, and this is I'm deferring to Megan, that there is a process for enrolling in another county, transitioning or transferring. But ultimately, you have to be Oakland County.
Yes, you have to be an Oakland County resident, and then we run people's Medicaid status to see what county they're in. We run it through the Access Center. The providers always run it before they provide services. And then we have a process to change county code to ensure any Oakland County resident who's in transition of moving, we are still able to service up.
And that number also, it talks about general types of services that are covered under these funds. So I'll just do ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health, and substance use disorder treatment services, including behavioral health treatment, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventive and wellness services, and chronic disease management, pediatric services. And that way, we'll, it's more or less the guidelines. It's helpful. Okay. Those are also those 2 open items. Thank you.
All right, we'll move on to legislative updates from Christine.
You should have these materials in your packet. And this year, the last year, was this service. I've got a copy. I will go over overarching legislative updates and then how there are some things that impact This board specifically will be of interest. I know there were some conversations about direct care wages, which impacts our overarching budget. Just to bring this board up to date, we're doing some advocacy and awareness locally and across the state. During the public health emergency, OCHN did increase wages for our direct care workers, using, again, as Charlie was talking about, there were some other ARPA dollars, other funding. Really key issue for us was staffing was a challenge during that time. Since then, what I have learned is legislators are putting forth some language that they want to bring the entire state up to $16, which is where we fund our providers to pay direct care workers. So there is some work in Lansing to increase. I think the state highest level you can do for state is $14.35. And so they are advocating, other organizations are advocating, but we as a county have prioritized our direct care workers. They are boots on the ground, front line, providing services for people. So this document just kind of explains a little bit about how we fund that rate. The other document, which is really important, and then I'll get to the redetermination piece. I'm sorry.
Oh,
Was there
is
a question?
Up to $60 now.
Yeah. Okay. When we received our budget with the redetermination, the actuaries miscalculated some of the funding for overtime for DCW. So you are given an allocated X amount of dollars are going to be put to the public mental health system. With our advocacy efforts, or our CEO, Dana Lesenby, and the other PIHP CEOs were advocating for the release the remaining dollars to the public mental health system. They did release $116 million statewide. Part of that did come to Oakland County, so it's based on codes. It does take some calculations. So what we're advocating now is for the remaining $94 million to be put back into the state system. We are having conversations with legislators when they build the budget for the public health system. They said X amount of dollars is allocated. They funded X amount of dollars into the system. They went back, reallocated 116. There's a remaining $94 million that, if it is put back into the system, it will help not just Oakland County, but all the PIHPs across the state who are adjusting to that first year out of the public health emergency. Some of the actuaries think that it's higher than 94 million that can and should be funded into the public health system. But we're using the conservative number of 94 million as a request. Any questions? So the last piece the year. So the way we managed that, the department would send information saying, please redetermine for your Medicaid eligibility and benefits. The provider would then contact people and say, please, it's time for you to redetermine. And then we as OCHN would follow up with correspondence that said, don't ignore the other notifications. Some of the things that we identified very quickly were that individuals may have been in Michigan, or maybe they have that Agent 1 or 10. And your funding is based not just on eligibility, but depending on your level of need. So we are actively now ensuring that individuals who were redetermined are put into the correct funding source. The other element that is very unique to redetermination, and I think caught all of us a little off guard, if we are going to develop a different flyer, different conversation, is there with a whole compartment that's almost like a family planning, what they call, that really has nothing to do with behavioral health services. And so people were being redetermined, thinking that they were getting to public mental health services, and then they were put in a funding category that does not apply. I say frequently, I think the state really is doing the best they can. It takes all of us to ensure that this redetermination is done effectively. None of us have lived through a public health emergency before, and we're all learning as we navigate our way. To Shelley's point, it's our first year coming out, but I think our team has been very diligent and engaged in being sure that we understand the number of people who should be redetermined, understand the funding source that they should be categorized for their services, and making sure that people are transitioned to those great funding buckets.
Okay, so regarding this Medicaid redetermination thing, since Medicaid's a state program now, are state employees doing that?
The department does have a team who is overseeing the redetermination process. They have a website. We have what we call Mara workers, so there are people within different PIPs who are working with individuals, families, and organizations to assist in making sure that people are redetermined. What is really unique, to Shelley's point, with the public health emergency, more people became eligible for benefits. As it ends, people are not working, and so that number is decreasing. We are funded in part based on that eligibility. So we had anticipated decrease. It's a little higher than we thought in terms of eligibility, but really when we saw the biggest significant change as well was making sure that people were actually being put to the correct funding source. It's easier to see than not. So if you are someone who is staff aged or blind, you should stay in that funding category. If you redetermine and put in a different category, it's unlikely that you can see that younger or can hear now. So that's how we're looking at those informations and working with our provider network. And that is a statewide initiative, but here in Oakland County, we did cross team with our provider network.
So the county, since it receives Medicaid dollars in state of flux right now, you said that we are partnering with
our service provider network. So our provider network's actually the responsibility to have people's Medicaid redetermined sits with our provider network contractually, but in that initiative and understanding the complexity of coming out of a public health emergency, we're being supportive of the department. Just to ensure people might get a lot of things really not understand the true significance of not having Medicaid until they go and get help. So the state's reaching, the providers are reaching, and then we're saying don't ignore anyone, and then we're going back now that some people have been redetermined over the last year to say when you were redetermined, great funding source and to ensure that they get the services they need.
And so the county can, like I'm thinking of your situation with your daughter, since there it was an actual the county can help someone that was incorrectly kicked off or
We can help
you guys.
Yeah. And that was one of the challenges, even with all families. It's not really unique. There were some glitches at the state level, glitches throughout. So it's just trying to better understand if individuals were not redetermined. How do we ensure that they get redetermined? Individuals were redetermined, but they were put in the wrong funding source. How do we ensure that they are transitioned to the appropriate funding source? And it's unique. This is something that to have this many people having to be redetermined in such a short time frame does take a lot of hands. The last thing I'll just bring to your attention is I know we talked before that as an organization, OCHN had put in for a budget request for the state. I know our CEO, Daniel Westby, had met with our legislators for several months. We were originally asking for approximately $4 million specifically to what we would call crisis continuum of care. So that included funding for YFCC, funding for some
renovations and improvements to our resource crisis center, a few other programs. Representative Steckloff had moved that forward for OCHN, Senator Bear, that he was also supporting it, so it has bipartisan support. The last we heard, the House has put in their proposed budget for I think a little over $2 million. So the hope is that since the House is putting some of that funding in the Senate, they'll be able to get some support on the Senate side as well. And then once it is in the budget, we'll be able to reevaluate the original proposal and then determine how we can disperse this money. So fingers crossed, crisis continuum care is a priority for this agency, and it is definitely a cross-program effort because people come to our crisis center for all different reasons, including substance use support. Any questions?
Okay, thank you. We're going to move to community outreach updates from Suzanne. Outreach updates.
Good afternoon. In the interest of time, I'm going to just kind of skate through some of these slides. The first few slides are informational. These are what I share with the general board. So I'd like to bring them to the Oversight Policy Board. So I do this on a monthly basis. Just highlight the events and activities that we are participating in. Really quickly, we did celebrate 10 Resource Crisis Center, celebrating its 10-year anniversary, our OCHN Resource Crisis Center, as well as OCHN is now 60 years old. So we have some little comments. I'll make sure we get them to excellent. Also, just some other quick things. We held a combined meeting earlier this morning. It's been a very busy day. We're also at the NAMI conference these last few days, so it lends itself to be very busy, especially being at Health Month, and things like that. All right. Just really quickly on this side, we also kind of do the May and June just look forward. The community baby shower is coming up, and I have a slide on that, so we're just going to move forward. This is another slide that I just talked about some of the press releases that we put out, as well as some of our advertising. But I'm going to highlight the SUD advertising campaign and some future slides. So this begins our advertising for SUD. We have developed some SUD grant funding. So we've developed a very comprehensive advertising campaign. It is out there now. So I'm hoping that you're hearing it, seeing it, following it, whatever you need to do to make sure you see it would be wonderful. So this highlights our social media efforts. So we have some SUD specific topics that are highlighted at least once a week using different hashtags like hashtag recovery is possible. We talked a lot about the SOAR funding. We do use some of that funding to sort of boost those social media efforts. So that means it's just kind of getting it some higher visibility on social media platforms. As well as we do highlight specific observances related to substance use disorder for the Fentanyl Awareness Day, as well as National Prevention Week that just happened this week. These are some images. I don't know if anybody visits some of our malls. We have advertisement in both the Phoenix Crossing and Tollbrook Mall. I've seen a lot of these and they look great. So you can get a visual here of the mall advertising. We've been doing some mall advertising for some of our other programs as well. We're going to try to link this commercial that you can see that we have on Comcast. We also have commercials on Channel 4 and Channel 7. So we were able to see those as well. So we'll do this one really quickly.
Recovery is possible. If you or someone you know is struggling with addiction, Oakland Community Health Network can help. Take advantage of Oakland Community Health Network's treatment services and become a recovery champion. It begins with a phone call and a conversation. Call 248-464-6363 or visit oaklandchn.org. Join the recovery movement today.
There is one. Yes. And there is
sound on.
Okay, good. All right, let's talk about this stuff real quick. Billboards and bus ads. This is an example of a billboard. We are throughout Oakland County on our billboards, Pontiac, Ferndale, Madison Heights, some of the interstates. So you can see those on our billboards as well as the bus ads. So now talking about some of our, so that's kind of the campaign, really quick. Any questions about the campaign? Like I said, we're everywhere. We're on television. We're also on radio. So we did some radio advertising with our veterans event, but we started doing one SUD radio advertising as well. And that is going to be ongoing for the rest of this calendar year. So hopefully you're not flipping stations. I know stations, but hopefully you're not flipping stations. Try to listen to some of our advertising.
Sorry, Suzanne, what station, what radio station?
So we are on the RIF. So if you'd like to listen to that station, that is a great station. And so 96.3 and the RIF and Bounce are the stations. I can't remember the dial number. 101 for the RIF, 96.3 and Bounce. That's it. Thank you. So it's 105.1 the Bounce, if you haven't listened.
All right, so in the interest of time, I don't know if you have like 30 more seconds or if we should table the rest of it to the next meeting.
Let me just talk about this, only because this is coming up before the next meeting. I won't talk about anything. Oh, there's a couple other things. So baby shower, our second annual baby shower coming up on June the 6th. It's going to be at Welcome Baptist Church. Could be a great event. We've got lots of vendors, lots of speakers, lots of great items for moms and babies. Next slide, please. And then also we have our upcoming, our community workshop, our webinar on July 11th. So it's going to be about safe prescription drug disposal. I'll talk about the next ones next time.
That's great, thank you.
Thank you.
All right, and I'm going to table prevention updates until the next meeting in July. So just quickly, pardon? So quickly, I started saying this before at the wrong time. Old business, follow-up from the last meeting. There are some documents in the packet related to board member roles, fiduciary obligations and responsibilities. Let's see now, any OPB member issues or announcements? There's the bylaws in there, which I thought were on the opposite page. Yeah, and let's see, what else is on the list here? Open Meetings Act and the guide for the directors. Right, it's in the packet and it's listed right on the agenda. All right, was there anything else, issues or announcements? All right, public comment? Motion to adjourn. All in favor?
Aye.
Motion approved. Thank you.
And it's right at 3.
Yeah.